right, welcome to Health and Human Services Finance. We do not yet have a quorum. We have three bills on the agenda today, House File 101, House File 104, and House File 105. Representative Backer will begin with Regional Emergency Medical Services. That's House File 101. And we will go ahead and go through the bill. Once we have a quorum established, we will go ahead and call the meeting to order and then officially move the bill. Representative Backer.
Chair and members, there will be a technical amendment when we have quorum, but just to give you some background, the legislator created the Minnesota Emergency Medical System Act. The Support Act is funded by general revenue dollars. The purpose of the fund is to develop, maintain, and improve regional emergency medical services, EMS. The purpose of the fund is also to provide financial assistance in common, local, regional, state emergency medical system needs, to provide grants for EMS projects with potential regional-wide significance, and to provide for public education about emergency care and to ensure the ongoing regional EMS systems. There are 8 EMS regional systems in Minnesota that we receive, as an EMS, we receive special funding from the collections of seatbelt enforcements. The special funding is known as the Emergency Medical Service Relief Act. The purpose of these funds is for education, training, and equipment. Like in our service, we get grants each year to provide equipment, help with our continual education. Like this year, we did our refresher for Browns Valley Ambulance, and those funds help with that. The biggest challenge that we're facing right now is, the good news is people are buckling up. We have about a 95% buckling up. The bad news is when you don't write fines, our funds decrease. So it's a good situation to be in because, of course, when more people buckle up, they don't call us as much. So, and that's, you don't want to see me at 2 in the morning, by the way. While the support act, you don't. Hey, dial 911, I'll show up. How about you, Buck?
Not no more.
No, okay. While the Support Act funds have remained constant, we've seen this discrepancy. And with the lack of funding, that's going to significantly put an impact on our training, equipment purchases, and just help with EMS readiness. With me today is my good friend Buck to answer questions and also to share additional information.
Welcome to the committee, Mr. McAlpin. Please introduce yourself.
Mr. Chair, members, Buck McAlpin here on behalf of the Minnesota Ambulance Association. We've been working closely with the 8 regional programs for quite a while, back to the inception of the program. And the last few years, we've had quite a focus on rural sustainability and rural EMS sustainability. And Mr. Griffith and Mr. Vanderwall will come up in a minute and talk a little bit more about what the programs do. And I think the neat thing about the 8 programs is, although they're very unique with training EMS personnel and things that they do locally, they all kind of adapt and fix to meet the needs if they have a large amount of first responder squads, a large amount of basic life support ambulance services, and they're a very important tool to what we do, especially in rural Minnesota. So Representative Backer's right, with the decrease of seatbelt dollars, the ambulance associations push forward, and we also have this included in the governor's budget, working with the state EMS regulatory board to add some more money to the general fund side and not chase after some dedicated fee to try to continue to support them, Mr. Chair.
All right, thank you, Mr. McAlpin. We do now have a quorum. I'll officially call the meeting to order. Representative Albright moves the minutes from February 9th. Any additions, subtractions, corrections? Seeing none, all those in favor of adoption of the minutes, please say aye.
Aye.
Opposed, no. The minutes are adopted. Representative Backer moves House File 101. House File, also Representative Backer moves the A1 amendment, the author's amendment. Any questions to the A1 amendment? Seeing none, all those in favor of adoption of the A1 amendment, please say aye.
Aye.
Opposed, no. The A1 amendment is adopted. Representative Backer, to your bill as amended.
We'll take any questions. So I have nothing else to share.
All right. We have a couple testifiers. We have Tom Vanderwall, Greater Northwest EMS, and Mark Griffin, South Central EMS. Welcome to the committee, gentlemen. Please introduce yourself for the record and proceed in any order you like.
Thank you, Mr. Chair and members of the committee. Like Chair Dean said, my name's Tom Vanderwall. I work with Greater Northwest EMS. We're based out of Bemidji. We cover a 12-county Northwest region. It's approximately 15,000 square miles. It's as big or bigger than 9 different states of the Union, and we have 20 ambulance services in that region. So it gets very, very challenging with Highway 2 dissecting that particular region. South of that region, there's a lot of advanced life support services. North of the region, there's many basic life support services, which is your volunteer EMTs, just like Representative Backer sits on the Browns Valley service, those very basic life supports. And in that area, some of my ambulance services cover 2,500 square miles. So the challenge is for that part-time ambulance manager to be on top of things, to be involved with the hospital coalitions, the Homeland Security grants, and some opportunities that may be there. They can't participate. So as a regional system, we are that catalyst that goes between that state agency, the intent, the initiative of funding, grants, other things like that, to ensure that that local service does provide the service to our citizenry of Minnesota. Ironically, when we talk about the seatbelt type of thing, I started working in Bemidji in 1999. Our seatbelt compliance for adults was like 65%. Kids were like 43%. Currently in the state today, we're at 94% compliance by the citizenry. So again, our funding dollars, those truly were the grant dollars that created a lot of the flexibility that Representative Backer is talking about. Our goal with this bill is to ensure our infrastructure is in place so that we can ensure that we can continue to have that bit of catalyst.
Mr. Chair, members of the committee, I'm Mark Griffith. I'm the director for the South Central EMS region out of Eagle Lake, Minnesota. And Tom did a very nice job of describing what we do as regions. In essence, at least in Tom and in my region, the vast majority of our ambulance services are staffed by volunteers. And one of the things that I think maybe summarizes nicely what Tom was put out there was that as a regional program, we can bring time and resources to those volunteers that they otherwise don't have. Tom and I have been very lucky this last year. We've both had some recruitment and retention pilot programs within our region that we were very proud of and had some very promising results. And the additional funding would help us ensure that we can continue to support those volunteers.
Thank you very much.
Thank you, gentlemen. Questions for either the testifier or the author? All right, seeing no questions, Representative Backer.
Chair and members would appreciate your support. Thank you.
All right. I forgot to ask if anybody from the audience would like to testify for or against the bill. Seeing none. All those in favor of adoption, please say aye. Aye. Those opposed, no. House File 101 is laid over for possible inclusion. Thank you.
Thank you.
As amended.
Did you want me to just stay up here?
Yeah, why don't we do 105? Oh. All right. Representative Backer, would you like to move House File 105?
Would like to move that, and we have a technical amendment also, and another amendment
All right.
that we'd like to include in that.
All right. See what we have. We have a DE1 amendment.
Yep.
Is that what you're referring to?
I do, but we also have Elizabeth House Research has a little technical one.
Ms. Clark, yes.
Mr. Chair, excuse me, Mr. Chair and members, on the DE1 amendment, on line 4, we need to delete the words "and Cooper Sam's Volunteer Ambulance Trust Account." So the title will end after program on line 4.
All right. Does everybody understand the amendment? It's line 1.4, striking the word and everything after it on line 1.4. And if there's no objection, we'll incorporate that in the DE1 amendment. Other questions for the DE1 amendment? Seeing no other questions, all those in favor of adoption of the DE1 amendment as amended, please say aye. Aye. Opposed, no. DE1 is amended. Representative Backer to 105 as amended.
Chair and members, 62% of Minnesota ambulance are staffed by volunteers like myself. We're on call anywhere from 12 to 24 hours and more. And when the pager goes, that's when we respond. So we do that as a volunteer service, still do our activities in our community. The Cooper Sam's Volunteer Ambulance Program was established in 1993 to recognize the service rendered by volunteer ambulance personnel and to reward volunteer ambulance personnel for their contribution for local and state, which as we get farther west in the state, south and north, that is what makes up our volunteer ambulance services. Volunteer ambulance services have what they refer to as a qualified ambulance service person. A qualified ambulance service person is someone who has terminated their active ambulance service, who has at least 5 years of credit ambulance service, and who is at least 50 years old. Payment from the program to a qualified ambulance service person is referred to as a longevity award. The Cooper Sam's Volunteer Ambulance Trust was established to accumulate resources to allow for payments of this longevity awards to qualified ambulance service personnel. The current base budget general fund appropriation for the program is $611,000. It was formerly $1 million. Longevity award payments exceeding the $611,000 are supplemented with the funds from the trust account. In 2000, by legislative action, $800,000 was removed from the trust account and transferred to the state's general fund. In 2009, by the same action, legislative action, $6.2 million was removed from the trust account and transferred to the state's general fund. This amount was never restored to the trust account. And so this bill helps to put money back into the account to reward volunteers who have served for years and years and years. And with me is Buck to answer any questions, and myself too, and address the committee.
Mr. McAlpin.
Mr. Chair and members, Buck McKelvin, Minnesota Ambulance Association. I think Representative Backer did a nice job talking about the bill. He's right, about 2009 and 10 when we had the large state deficit. The $6.2 million was taken out of the fund. That was the big batch that kept this moving forward. And over the summer, the EMS Regulatory Board we've worked closely with said that the fund was going to not be able to pay out about 65 volunteers in 2018 and 19. So we worked hard to say, instead of putting money back into the trust fund, how could we just have an annual appropriation what would cover the retirements, or not even retirements, but it's a incentive program annually. And the average payout now is about $7,500 to $8,000 after your service credits that Representative Backer talked about. And these are for folks that make less than $6,000 annually on a ambulance, and that's our rural folks for doing ambulance paid time. So the amendment that Representative Backer will offer here in a few minutes, Mr. Chair, actually adjusts some of the funding, and working with the EMS board as we try to line this up with your budget in the Senate, it looks like we need $1.3 million annually as just an appropriation to make the commitments to the volunteers across the state.
All right, and is there another amendment? I think we incorporated the changes, Mr. McAlpin, so I believe we're
good.
We're done. There are questions. Representative Liebling.
Thank you, Mr. Chair. And what I'm a little unclear about is this difference between the trust fund and just giving the money to the board. Could you kind of discuss that a little bit more? You know, why one versus the other? What is the trust fund for? And just give us a bit more on that, please.
Mr. McAlpin.
Mr. Chair, Representative Liebling, the money, I believe, will still go into the trust fund, so if they don't spend the whole 1.3 million a year. But we've saw numbers looking at some actuarial stuff that shows it needs 1.26, 1.1, but that anything left in that would sit in the trust fund. So the board, in essence, the EMS Regulatory Board, wouldn't hold the money. It would still sit in the state trust fund like some of these other retirement accounts do. So if there was a balance left in there, it could generate income.
Well, Mr. Chair, I don't know if, I hope other people understand this better than I do, because I don't. So, you know, maybe I need a bit of a more basic explanation that maybe Mr. Berg could take a crack at it, Mr. Chair, if he would be willing.
Mr. Berg?
Mr. Chair, Representative Liebling, it's pretty straightforward. I believe the trust account is an account, I believe, in the general fund. So it's actually a general fund appropriation to a specific account in the general fund, which is called the trust account. And as Mr. McAlpin suggested, they pay out awards based on the criteria and statute, and if there is an excess of the appropriation of that account from the, after deducting the payouts, it remains in that account and does not cancel.
Okay, Mr. Chair.
Representative Lee.
Okay, thank you. I think what was confusing to me is the use of the term trust fund, because it's not what we think of as a trust fund, which has another kind of legal meaning. So, thank you.
Mr. Chair, Representative Liebling, it's referred to as the trust fund in statute, but it's in fact an account in the general fund.
Representative Loeffler.
Thank you, Mr. Chair, and maintaining good ambulance service statewide is really a priority. And I've heard about how, particularly in some parts of Minnesota, it's really hard to recruit people into the program. And yet it looks like this program actually, if I understand it, did you say that to qualify for the longevity awards, you have to be over age 50?
Representative Backer.
Chair and members, yes, that is correct. That's how it was set up back in 1993. So, correct?
Oh.
Go ahead, Bud.
Mr. Chair, Representative, I think we're talking about the same thing. At 50, you can take the payout. So I could get that at 18. I start collecting my credits if I go 18 to 50. But at 50 years, after 50 years of age, I can get my payout from the state.
Okay, thank you. And Mr. Chair, Mr. McAlpin, so this is like a one-time payout that you can decide when you're going to take it?
Yes, it is. Chair and members, yes, one time.
Okay, thank you, Mr. Chair, because I was a bit confused because it said they'd, on average make 6,000 or less in paid time. I think people need to realize that they get paid for this, but then the average payout was 7,500 to 8,000. It seemed like we were really tilting towards rewarding the older serving people and not, maybe if we'd shifted it more towards better pay at the beginning, we could recruit more people in. But I understand now how it works. Thank you.
Representative Considine.
Thank you, Mr. Chair. Now I'm confused. Is that you said they can start collecting it at, say, 25. So is that 25 years of 7,500 a year?
Mr. McAlpin.
Mr. Chair, Representative, every year, so say at 18 years old, I joined the Bellevue Ambulance Service. And at 18 years, every year, the EMS Regulatory Board sends out a form that Jeff is Representative Backer is my ambulance director, has to verify and have an affidavit signed and notarized that I was paid less than $6,000 of runtime by the Bellevue Ambulance Service. Then that goes into the EMS Regulatory Board, and they establish service credits. So for every year of service, I get a credit. Once I hit the 5 credits, I get some type of payout. The longer I serve as an ambulance attendant, the more the The payout is, one credit has a cash value to it for the payout. So the longer I serve for Representative Backer on his ambulance service, the more service credits I can build and the bigger my payout is. And then at 50 years old, I can apply to the state to get my service credits paid to me.
Follow up, Mr. Chair.
Representative Considine.
Thank you, Mr. Chair. So if somebody joined the ambulance service, like you said, at 18, and at 23 started accumulating these credits, and they went to 50 and they got their credit every year, what kind of a payout are we talking about?
Mr. McAlpin.
Mr. Chair, Representative Constantine, I'm actually looking at, in 2017 payouts, there is 211 volunteers claiming, and their payout will be $6,691.
6,600 per year or total?
Total.
How?
So it's a stipend program. Yep.
Thank you very much for explaining that to me. Thank you, Mr.
Good
Chair.
questions.
All right, further questions? Seeing none. Does anyone in the audience want to testify for or against this bill? Seeing none, Representative Backer, final thoughts?
Would appreciate your support. Thank you, Chair and members.
All right. House File 105, as amended, is laid over for possible inclusion in our omnibus bill. Next up, we have Representative Zerwas.
Is that me being loud again?
Got sad words in sad words. All right, Representative Zerwas is ready to go. House File 104. Representative Zerwas moves House File 104 be laid over for possible inclusion in the Health and Human Services Omnibus Bill. We have the bill before us. Representative Zerwas, to your bill.
Mr. Chair, members, I'll be brief. Today's bill deals with the CALS, Comprehensive Advanced Life Support Training Fund. CALS is the CALS is the Comprehensive Advanced Life Support Training Program that's designed specifically for rural healthcare providers to meet their advanced life support training needs. It offers 2 unique courses, the 2-day interactive provider course and the 3-hour trauma skills module, which is the hands-on course. CALS training teaches an effective approach to the care of critically ill or injured patients, manifesting a wide range of emergencies or other incidents. More than 96% of program participants report that taking CALS training course enhanced their skills, confidence, and teamwork. This is training that's been in statute, I think, since 1999, and has been specifically geared towards rural emergency healthcare providers, helping folks provide that emergent care in a rural setting. It's designed specifically for rural healthcare practitioners. It's adaptable to the specific needs. If your community has maybe a critical access hospital, it can be geared towards getting patients prepared and ready to go to that hospital before a life flight transport to the metro area. It identifies the essential equipment and training that you would need for your specific portion of the state. It includes training in everything from newborn patients all the way up through geriatric patients. With me today to answer any additional questions is Buck McAlpin from the Ambulance Association.
Mr. McAlpin, anything further?
Mr. Chair, I think Representative Zerwas did a nice job with it. This came with our work group at the Ambulance Association and the emergency physicians. CALS gets currently $408,000 for the biennium, but we're starting to notice in rural Minnesota that some of the paramedics, nurses, and physicians, and the goal behind this is a team-approached care, and where we know Hennepin County regions or north are our large volume trauma centers, see this stuff every day and put in chest tubes and do things that you may not see in the Bowabic Hospital on a daily basis. This takes these skill set and these practitioners out to rural Minnesota and helps them work inside their hospitals with their teams so their staff can stay there during the day while they take this training. And part of this is CALS would like to use some of this appropriation to work on a more robust online course, so a lot of this didactic part can be completed before the practitioners show up to offer CALS. And CALS is a very significant part of our statewide trauma system and how we're sure that our staff are designated. So when the Department of Health goes out and certifies and designates our trauma centers, this is a big piece of their training tool they have to do that.
All right, questions, Representative Loeffler.
Thank you, Mr. Chair, and Mr. McElcon. It sounds like this is an independent training program, and I'm wondering why it is integrated with our higher education systems, which have, you know, resources in creating online programs and are training paramedics, and if there might be some higher ed resources that could partner into this.
Mr. McAlpin.
Mr. Chair, I think that's actually a good idea, Representative Loeffler. They may have the network and the system around the, especially the interactive TV type training with it. Good point.
All right. And Mr. McAlpin, could you just talk about, I understand the interest in getting greater Minnesota experience with EMTs. Can you just talk, is that transferable back here, or what difference does it make, and how does that help being, if you're from one place and you get trained in another place, how does that help?
Mr. Chair, we're very unique as certified practitioners in Minnesota that we kind of all follow across the state on the EMS side, what's called the West Metro protocols, really developed by large systems that we kind of spread out around the state that our state EMS regulatory board has available on their website. So we're kind of proud to say that a paramedic trained in North Minneapolis in Hennepin County can go up to International Falls and follow some of the same guidelines and some of the same training standards. So in essence, with what CALS does or any of our advanced training programs, our curriculum and modules look very similar, so folks can work around the state. And I think for the large EMS systems that aren't just only Alina or North Memorial in the metro, they're located all over the state too, as they've kind of filled some of that role of systems that couldn't stay in operation anymore. So it really adds a standardized approach to what we do across the state. So we'll provide trauma care for a patient of how we do airways and the type of drugs we give and what type of fluids that we give people. Is it normal saline or lactated ringers or blood products that we would all over the state, so it looks standardized.
So it's not just trying to get geographic balance, but it's also trying to train people to treat different kinds of things, but also so that you yourself can treat in different parts of the state and get different experiences.
Correct, Mr. Chair.
All right.
Mr. Chair, I guess I would look at this in concert to some of the other work we've done over the last couple bienniums around the statewide stroke protocol and a couple of the other statewide response systems. You know, no matter where you are in the state of Minnesota, our hope is, and at that time your prayer is, that the individuals in that health system at that hospital are prepared and ready to respond in concert and in cooperation and up to the latest standards of care.
All right. Other questions? Does anyone from the audience want to testify for or against this bill? Seeing none, final thoughts, Representative Zerwas?
Thank you, Mr. Chair, for hearing the bill.
All right. House File 104 is laid over for possible inclusion in the Health and Human Services Omnibus Bill. Thank you, Mr. McAlpin. Thank you, Representative Zerwas. Our next meeting will be tomorrow, Wednesday, February 15th, and we will continue to work our way through bills. With that, we are adjourned.